Hi, my name is Elizabeth Brimmer. I'm Clinical Director for London Professional Aesthetics. I'm just here to make a really short video today to answer a question that keeps cropping up in clinic of late. And I thought it was a really good question and therefore worth sharing with everyone. So this question relates specifically to PRP when we're treating for hair loss. So PRP stands for protein-rich plasma, and it's a treatment that we use not only to refresh and revive the skin, but we can also use it to stimulate hair growth in people who are finding that their hair is getting a bit thin, experiencing hair loss, that kind of thing. So it's a treatment that's for both men and women. And the question that keeps coming up is that what else can I do whilst I'm having a course of treatment for hair loss? So one of the things that is very common, particularly amongst men, is that when they start to notice that they're losing their hair or the hair's getting thin, they get onto the internet and they will source some prescription medication over the internet, which helps from a hormonal perspective to try and stimulate their hair growth. What we have now is the ability to actually identify the cause of your hair loss, and this is done by using a DNA swab. So the actual process involves going through a medical questionnaire. We tend to do it online, and you take a spongy stick and you take the swab during this video consultation just so that we can kind of monitor how you're doing it. Get sent off to a lab in Spain. About 4 weeks later, you will get a report which identifies the reasons that you are experiencing hair loss or hair thinning. And added to that, you will also get a prescription or advice on prescription medications and topicals and vitamins that will actually benefit you and the individual causes that you have for your hair loss. So this is really putting an end to kind of stabbing blindly in the dark and just grabbing a medication off the internet that other people have used and that you've read might help. So this method of actually testing what the causes are for you mean that you can take medications, use topicals, take supplements that you know are going to help. So it's just taking the kind of doubt and genericness out of the whole equation. So you're doing something that you know is going to help. Now, combining that with your PLP, with your biotin injections, is really going to give you that gold star result. So my top tips for getting the best out of PRP for hair restoration, whether you're a man or a woman, it doesn't matter, is not only to have the course of treatment, but to have a DNA test and identify exactly what is going on in your body that's resulting in the thinning of your hair, so that we can then create a bespoke treatment prescription plan for you to use treatments that are going to do something. And as with the skin, this kind of what I call this multi-layered approach just means that you're far more likely to get better results, to feel happier with the results, and to just benefit from stimulating hair growth in different ways will lead to a better overall outcome. I hope that's been helpful, and if there's any other questions that you have around this topic, please do get in touch. We're always interested to hear what you're thinking and what your questions are.